So everyone, very good evening. Is it audible to everyone there? Yes. So we'll be discussing all the important topics of all the FMGE exams for you. So just 1 hour session will be rapid recap होगा. फिर जितने भी topics है ना पूरा एक बार साथ में पढ़ लेंगे. पूरा rapid revision session जैसा हो जाएगा 1 घंटे के अंदर जितने भी previous year topics ना. So crude death rate. What is the denominator of crude death rate? If they ask, it is mid-year population. Population के अंदर क्या risk है death होने का? That is crude death rate. Age group or male female. If I want to compare risk of death in different age groups or male female, use specific death rates. डिसीज का बर्डन पता करने के लिए अगर टोटल डेथ्स है उसके अंदर टीबी का कितना कंट्रीब्यूशन है, उसमें टीबी का कितना कंट्रीब्यूशन है, वो देखने के लिए वी यूज प्रोपोर्शनल मोर्टेलिटी रेट. और एक एक डिसीज का विरुलेंस फैक्टर निकालना होगा, किलिंग पावर ऑफ ए डिसीज. वी कैलकुलेट केस फेटालिटी रेट्स. दो पॉपुलेशन है उनके बीच में risk of death I want to compare. I want to compare risk of death between two populations with different age structure. We have to do standardization, direct standardization करने के बाद we get each standardized death rates. Whatever each standardized death rates we have, we can compare mortality between two populations with different age structure. ये words होना चाहिए question में. Listen, this word should be there in the question. Standardized mortality ratio. Observed deaths by expected deaths formula. It is used to compare mortality between occupation. For example, coal miners, general population. If I want to compare which group is having more risk of death, we use standardized mortality ratio. Coming to the next, see the words incidence, prevalence. क्या मतलब incidence means new cases in the population at risk. We do follow up, so the study is cohort study. It will indicate how many will develop disease. So you are starting from exposure going towards outcome. So it is cohort study which gives incidence for you. But already है community के अंदर जो existing cases है ना, that is called as prevalence. Cross sectional study, it will indicate how many are having disease. Denominator is total population, means how many are having disease, that is burden. If I want to estimate risk, अगर risk पता करना है ना, we use incidence. If I want to know the burden, we use prevalence. Indicate burden of diseases. See this word prevalence, जो है community के अंदर cases है ना. So if you are seeing here prevalence, that depends on two factors. Incidence. If new cases are increasing, prevalence will increase. If more death, more cure. अगर death हो गया, cure हो गया, तो prevalence will be less because existing cases will come down. So prevalence also depends on duration of disease, whether the disease is acute or chronic. Acute diseases less prevalence, chronic diseases more prevalence. That is what they are asking in the exam. Next, ये भी पूछेंगे आपको what is human development index, what is physical quality of life index. Countries I want to compare, which country is having better way of living. Standard of living between two countries. If they ask this question, standard of living between two countries, if I want to compare, we use human development index. So क्या क्या measure होता है HDA के अंदर? Knowledge we check, income we assess, longevity means how many years they are living. Knowledge part, mean years of schooling. On an average, how many years they go to school. Expected years of schooling depending on the dropout rate. So उनका dropout rate ज़्यादा होगा तो expected years will be less. So country का status is less. So what are the two indicators? Repeat. Good. Mean years of schooling and expected years of schooling. Very good. Income में क्या check होता है? Repeat. Comment. Very good. GNI per capita GNI we check in income. Longevity में क्या assess करेंगे? Tell me. Very good. Life expectancy at birth. So क्या निमोनिक था क्लास में डिस्कस हुआ था ना, KIL. What is the mnemonic? Kill. Knowledge, income, longevity. So 3 dimensions, 4 indicators we are using. If they ask quality of life, I want to compare between two countries. Income check नहीं होता. Listen, we don't consider income. Remember this point. Repeat, comment. Very good. No income. Very good. Infant mortality rate. Yes. Literacy rate. Yes. Life expectancy at age 1. So what is the mnemonic? Repeat with me. LILL. Very good. यहाँ पे क्या mnemonic है? KIL. Type it in the chat box. Comment it. Very good. Kill. L. Repeat. Kill. L. Kill किसके लिए होता है? Repeat. HDI, Human Development Index. For ill, Physical quality of life index, very good. नेशनल इम्यूनाइजेशन शेड्यूल, वेरी वेरी इंपॉर्टेंट टॉपिक. फिर आपको बहुत सारा क्वेश्चंस इसके अंदर आएगा ही आएगा, मतलब या तो बच्चों में पूछेंगे नहीं तो प्रेगनेंसी. सो दे विल आस्क क्वेश्चंस ऑन चिल्ड्रन एंड द प्रेगनेंसी वाइज. हाउ मेनी लाइक व्हाट आर द वैक्सीन्स वी एडवाइज फॉर प्रेगनेंट्स. सो बर्थ में क्या देते हैं, रिपीट, वेरी गुड. BCG, यस. ओरल पोलियो वैक्सीन 0 डोज एंड हेपेटाइटिस बी बर्थ डोज. क्या निमोनिक है, बॉब. BCG, OPV 0 dose and hepatitis B birth dose. Very good. 6, 10, 14 weeks. 6, 10, 14 weeks. अगर months में देंगे तो 1.5 month, 2.5 month and 3.5 month. Oral polio vaccine. Tell me good. OPV 1, 2, 3. Very good. यहाँ पे देखो pentavalent 1, 2, 3. Rotavac 1, 2, 3. Rotavac 1, 2, 3. Pentavalent मतलब क्या होता है, रिपीट. Yes, good, answer it. Very good. Pentavalent means 5 things. DPT 3 हो गया. डिप्थीरिया, पर्टोसिस, टेटनस. उसके साथ BB, हेपेटाइटिस B एंड हिमोफिलस इन्फ्लुएंजा B. तो कितना इंक्लूड हो गया, 5 थिंग्स आर देयर इन पेंटावेलेंट वैक्सीन. रोटावैक, यस, रोटावैक. IPV फर्स्ट डोज एंड सेकेंड डोज. 6 वीक्स में फर्स्ट डोज, 14 वीक्स में सेकेंड डोज. PCV first dose, second dose. Repeat, 6 weeks में first dose, 14 weeks में second dose. Then comes 9 months. Measles 1, that is first dose. Most of the states they are not using measles. What they are using? MR1. Yes, very good. What you are answering is very good. MR1, MR first dose. MR first dose. 9th month में देते हैं. साथ में क्या देते हैं, विटामिन ए. कितना विटामिन ए 9th मंथ चाइल्ड के लिए, कितना विटामिन ए देना चाहिए प्रोफिलैक्टिकली? टेल मी, प्रोफिलैक्टिकली कितना, हाउ मच? 1 लाख. वेरी गुड. 1 लाख इंटरनेशनल यूनिट्स. फिर साथ में जेई सारा स्टेट्स, एवरी स्टेट्स जेई इज गिवन. ट्रू और फॉल्स? फॉल्स. एंडेमिक एरियाज ओनली. वेरी गुड, ओनली इन एंडेमिक एरियाज. PCV बूस्टर कब देते, रिपीट, 9th मंथ. IPV थर्ड डोज. ये जो नया एडिशन है ना, इसको हाईलाइट करो, लिखो. I'll be giving the PDFs for you, don't worry. The slides, whatever I'm discussing in your this session, you'll be getting it. IPV third dose. 16 to 24 months. DPT first booster. 1 साल क्रॉस हो गया चाइल्ड का एज, सो बूस्टर की जरूरत है. DPT फर्स्ट बूस्टर, OPV बूस्टर, measles second dose. So how many doses of measles? 2 doses, either in the form of measles or MR. So most of the states are using MR only. क्या होता है MR? Measles, rubella. MR1, MR2, G2, when we give 16 to 24 months. Very good. Then comes 5 to 6 years. DPT second booster. एडोलसिन में क्या देते हैं 10 ईयर में? TD1. 16 ईयर TD2. याद रखना, TD1, TD2. प्रेग्नेंट, यस. पहले TT देते थे, अब TT है नहीं. We don't give TT vaccine. It is TD vaccine. First and second. गैप क्या होता है? 4 weeks. In between them, the gap is 4 weeks. TD booster. What is the importance? If the pregnancy happens within 3 years, she has been vaccinated. If the pregnancy happens within 3 years, so क्या मिलना चाहिए उसको? Booster, TD booster. ये वाला याद रखना है आपको. 3 years. पहले वो vaccinated है. Very good. Within 3 years, she is pregnant again. TD booster. वैक्सीन के साथ उसका साइड इफेक्ट्स भी देते हैं. मीजल्स, यस. BCG लाइक दिस. दीस आर वेरी इंपॉर्टेंट. व्हाट यू आर आंसरिंग? यस, वेरी गुड, करेक्ट, वेरी वेरी गुड. यस, यस, करेक्ट बेटा, गुड, सही है, वेरी गुड. लिसन, सुनो. BCG वैक्सीन कैसे देते हैं? BCG वैक्सीन 0.1 ml इंट्राडर्मल लेफ्ट डेल्टॉइड. यहाँ पे मिलेगा BCG लेफ्ट डेल्टॉइड में ना, इंट्राडर्मल टेक्निक है. स्किन सुपरफिशियली देते हैं ना. वेरी गुड, गुड, करेक्ट. क्या क्या है एडवर्स इफेक्ट यहाँ पे वैक्सीन देने का मतलब? लिम्फ नोड्स, सपोरेटिव लिम्फेडिनाइटिस, BCG ऑस्टाइटिस, डिसेमिनेटेड BCG इन्फेक्शन. सो लंग इन्फेक्शन भी होगा थोड़ा सा. मीजल्स, MR, MMR. सो देयर विल बी थ्रोम्बोसाइटोपेनिया एंड टॉक्सिक शॉक सिंड्रोम. अगर वैक्सीन ठीक से प्रिपेयर्ड नहीं है ना, देयर विल बी टॉक्सिक शॉक सिंड्रोम. Child will have fever, diarrhea, shock. Repeat with me. Very good. Yes, correct. What you are typing is correct. Fever, diarrhea, shock. क्या क्या होता है child? Yes, fever, diarrhea, shock. Very good. Oral polio vaccine का क्या side effect है? VAP. Vaccine associated paralytic polio. It can cause paralysis in the child. We call it as VAP. Vaccine associated paralytic polio. पर्टोसिस, इफ आई यूज होलसेल पर्टोसिस, किसके अंदर होता है पर्टोसिस? डीपीटी, यस, डीपीटी में पर्टोसिस कंपोनेंट कैन कॉज ऑल द साइड इफेक्ट्स, इनकंसोलेबल स्क्रीमिंग, सीजर्स, हाइपोटोनिक हाइपोरेस्पॉन्सिव एपिसोड, जो मैंने एलेड किया ना वो सब इंपॉर्टेंट है। हाइपोटोनिक हाइपोरेस्पॉन्सिव एपिसोड इज ड्यू टू डीपीटी, बट डीपीटी के अंदर कौन सी कंपोनेंट है? पर्टोसिस, वेरी गुड। रोटावैक, इंटरसेप्शन, वेरी वेरी इंपॉर्टेंट। ओरली देते हैं ना रोटावैक, कितना ड्रॉप्स देते हैं रोटावैक? टाइप इट इन द चैट बॉक्स, वेरी गुड। हाउ मेनी ड्रॉप्स? 5 ड्रॉप्स, वेरी गुड, 5 ड्रॉप्स। पहले कितना देते थे? 5 ड्रॉप्स। अब कितना देते हैं? 5 ड्रॉप्स। ये देयर इज नो चेंज, इट्स नॉट 3 ड्रॉप्स, इट इज 5 ड्रॉप्स। रोटावैक। ओपन वायल पॉलिसी का मतलब क्या होता है? वैक्सीन के अंदर ये जो वर्ड्स है ना, ओपन वायल पॉलिसी, यू आर ओपनिंग द वायल, कुछ बच गया आपके पास, समथिंग इज लेफ्ट आउट, फिर उसको आगे यूज कर सकते हैं। क्लियर, वेरी गुड, यस, गुड। हाउ मेनी वीक्स, इसलिए डेट एंड टाइम मेंशन होना चाहिए। हाउ मेनी वीक्स वी कैन यूज? 4 वीक्स, 28 डेज तक यूज कर सकते हैं, इसलिए डेट टाइम शुड बी मेंशन्ड। इट विल हेल्प इन रिड्यूसिंग वैक्सीन वेस्टेज, यस, कुछ बच गया उसको आगे यूज कर सकते हैं। It will help in reducing vaccine wastage, yes, good. Now listen, not applicable to BCG, क्योंकि डाइल्यूट करते हैं हम, उसको आगे यूज नहीं करेंगे। वी आर डाइल्यूटिंग इट, वी आर नॉट यूजिंग इन द फ्यूचर सेशन, यूज नहीं कर सकते हम उसको। मीजल्स, यस, उसको भी डाइल्यूट करते हैं, आगे यूज नहीं करेंगे। जेई लाइव डाइल्यूटेड है, डाइल्यूट होता है, फिर आगे यूज नहीं करेंगे। कोविशील्ड कोवैक्सीन के पास वीवीएम नहीं है, वैक्सीन वाइल मॉनिटर नहीं होता है ना, तो वी कैन नॉट यूज इट इन द नेक्स्ट सेशन। नॉट एप्लीकेबल फॉर BCG, मीजल्स, जेई लाइव एंड कोविशील्ड। बाकी जितने भी वैक्सीन साइट इज एप्लीकेबल, ये याद रखना। जेई किल्ड, इट इज एप्लीकेबल। रोटावैक ऑल्सो इट इज एप्लीकेबल। नेक्स्ट, डेफिनेशंस पूछेंगे आपको क्वेश्चन के अंदर। व्हाट इज इंक्यूबेशन पीरियड? टेल मी। एक्सपोजर टू फर्स्ट साइन एंड सिम्टम, ये जो गैप है इंक्यूबेशन पीरियड है। What is median incubation period? Time taken for 50% of the cases. अगर एक आउटब्रेक हो गया, if there is an outbreak, out of total cases, how much time it took? Yes, very good. How much time it took for 50% of the cases to develop? क्या बोलते हैं उसको? Median incubation period. Very good. What is GT generation time? एक्सपोजर से लेके मैक्सिमम इन्फेक्टिविटी तक का कितना टाइम लगता है? एक्सपोजर टू साइन एंड सिम्टम इज इंक्यूबेशन पीरियड, but exposure to the day of high infectivity, that is GT generation time. Serial interval, words को split करो। इंटरवल मतलब गैप, सीरीज का मतलब क्या होता है? प्राइमरी सेकेंडरी के बीच में जो गैप है। प्राइमरी केस अब हो गया फैमिली के अंदर, फीवर, रैश, 10 डेज का गैप है, फिर उसके बाद सेकेंडरी केस हो जाता है। ये जो 10 डेज का गैप होता है ना, क्या बोलते हैं हम उसको? व्हाट वी कॉल इट एज? रिपीट, वेरी गुड इन द चैट बॉक्स, यस। सीरियल इंटरवल, यस, कमेंट इट, सीरियल इंटरवल। इट्स एन इनडायरेक्ट एस्टिमेट ऑफ इंक्यूबेशन पीरियड, यस। आपको इंक्यूबेशन पीरियड किसी भी डिसीज का पता करना होगा ना, तो फिर सीरियल इंटरवल निकालते हैं हम उसको। रिपीट, सीरियल इंटरवल इज एन इनडायरेक्ट एस्टिमेट ऑफ इंक्यूबेशन पीरियड। व्हाट इज पीरियड ऑफ कम्युनिकेबिलिटी? द टाइम around which the infectious agent can spread. So till then the child will be under isolation. Period of communicability का importance कब आएगा? To keep the child under isolation. But incubation period तक observe करते हैं ना exposed individual को, that is called as quarantine. हाँ, what you are telling is different. Quarantine is for exposed individual, observing exposed individual for how many? Maximum incubation period, that is quarantine. But पेशेंट को सेपरेट करते हैं ना, व्हाट इज इट कॉल्ड एज? आइसोलेशन अराउंड द पीरियड ऑफ कम्युनिकेबिलिटी। लेटेंट पीरियड इज फ्रॉम डिसीज इनिशिएशन टू डिसीज डिटेक्शन। टुडे if the patient is having symptoms of cancer, after how many years the cancer will be detected? Usually it is used for non-communicable diseases, disease initiation to disease detection. What is this gap called as? Latent period. Now tell me, quarantine is done for maximum incubation period, true. Isolation is around period of communicability, true statement. ये दो statement important है आपके लिए. Next, study designs chapter है ना. Listen, this chapter is important. ऊपर ऊपर पूछेंगे, screening exams है ना, इतने डिटेल में नहीं पूछेंगे आपको. Main things they will ask. स्टडी डिजाइन चैप्टर है. केस स्टडी का मतलब क्या होता है? एक केस को स्टडी करोगे. केस स्टडी मतलब एक ही केस को स्टडी किया आपने. एटिपिकल मैनिफेस्टेशन है, अभी तक आपने देखा ही नहीं केस, Atypical manifestation, you have never seen a case like that. Fever, rash, palm soles, everything is involved. Almost atypical manifestation, that is case study. Case series means English, more than one case. 3 to 4 cases will present like that from the same family. If you are studying 3 to 4 cases, क्या बोलते हैं उसको? Repeat. Yes, very good in the chat box. Case series. Case study और case series में क्या फर्क है? Study मतलब one, series मतलब more than one. Cross sectional study means doing study at one point of time. Today you go to the class, out of 100 students, 20 are having refractive errors. Repeat. Today you go to the class, out of 100 students, 20 are having refractive errors. 20% is the prevalence. Repeat my words. कितना हो गया prevalence? 20%. So cross-sectional studies से क्या मिलेगा आपको? What we get from cross-sectional study? Tell good. Prevalence. Prevalence will indicate what? Burden of disease. Burden. Keys and controls means you are taking two groups. For example, smoking lung cancer. लंग कैंसर केसेस एक तरफ लिया आपने, फिर हेल्थी कंट्रोल्स लोगे तो कंपैरिजन हो गया. इट्स ए कंपैरिजन स्टडी, इट्स एन एनालिटिकल स्टडी. इट्स एन एनालिटिकल स्टडी वेर यू कंपेयर टू ग्रुप्स. सिर्फ केसेस को स्टडी करोगे तो केस सीरीज है. केस के साथ कंट्रोल्स को भी स्टडी करोगे ना, इट इज केस कंट्रोल स्टडी. रिपीट. केस कंट्रोल स्टडी. Matching is very important. When you take case, for example, 50-year-old male, select controls. Age 50 year, sex male, same होना चाहिए. 60-year-old male, this is called as matching. Matching means matching the factors, age, sex, all these other factors वो match हो गया. उसको क्या बोलते हैं हम उसको? Confounding factors. If I ask question like this, matching will eliminate the effect of other known confounding factors. Correct. क्या करते हैं हम कंफाउंडिंग फैक्टर हटाने के लिए केस कंट्रोल में? व्हाट वी डू? मैचिंग. एक्सपोजर असेसमेंट. फिर देन वी आस्क एक्सपोजर. हाउ मेनी आर स्मोकर्स इन केसेस, हाउ मेनी आर स्मोकर्स इन कंट्रोल्स. दो ग्रुप के बीच में एक्सपोजर कंपेयर करोगे, दैट इज कॉल्ड एज case control study. After taking the exposure, sometimes cases will recall the exposure more. So that is ज़्यादा मतलब they will think more because of disease status. That will be like they will go back and they will think more and they will recall their exposure better. थोड़ा ज़्यादा सोचने के लिए मजबूर हो जाता है ना, cases है. फिर that excess of recall is called as recall bias. Very good sir. Yes. एनालिसिस जब कैलकुलेट करोगे, विल बी कैलकुलेटिंग ऑड्स रेशियो. क्रॉस प्रोडक्ट निकालते हैं हम टेबल में, एडी बाई बीसी, दैट इज इंडिकेटिंग स्ट्रेंथ ऑफ एसोसिएशन. ऑड्स रेशियो इज फ्रॉम व्हाट स्टडी? केस कंट्रोल स्टडी. ऑड्स रेशियो विल इंडिकेट व्हाट? Strength of association. Now come to cohort study. Exposed group, non-exposed group. Smokers एक तरफ, नॉन स्मोकर्स और एक तरफ. टू ग्रुप्स को लिया आपने. फॉलो अप करना होगा. इस ग्रुप को भी फॉलो अप करोगे, उस ग्रुप को भी फॉलो अप करोगे. बीच बीच में कुछ स्टडी से छोड़ के चले जाते हैं ना. Someone will leave the study in between. It is called as dropouts. Attrition bias is seen in cohort study. Attrition bias means loss to follow up. Last we calculate incidence means how many new cases. How many new cases in group 1? How many new cases in group 2? Repeat. How many new cases in group 1? How many new cases in group 2? So group 1 versus group 2. Incidence in exposed group divided by incidence in non-exposed group. क्या मिलेगा आपको? Repeat. यहाँ भी incidence है. Incidence in exposed group divided by incidence in non-exposed group. What do you get? Risk ratio. Risk in exposed group divided by risk in non-exposed group. Risk ratio is used, yes, to express strength of association. कौन सी स्टडी के अंदर? कोहॉर्ट स्टडी. केस कंट्रोल स्टडी में क्या रेशियो? रिपीट. ऑड्स रेशियो. सो टेल मी वन बाय वन. वन केस. यस, वेरी गुड. केस स्टडी. यस. मोर देन वन केस. सीरीज. एट वन पॉइंट ऑफ टाइम. क्रॉस सेक्शन. केस के साथ कंट्रोल. केस कंट्रोल स्टडी. क्या रेशियो? रिपीट. यस, ऑड्स रेशियो. एक्सपोज, नॉन एक्सपोज, risk ratio, cohort study. Now come to this. What they ask for screening exams is how to calculate sensitivity, specificity. usually for you. So no, listen now. Patients with bowel cancer. You are having individuals with bowel cancer. Total 20 plus 30 are having disease. Here, normal 180 plus 1820. 1820. So you are adding 180 to this. So it will become 2000. 2000 normal individuals. एक स्टडी करोगे स्क्रीनिंग टेस्ट है. आउट ऑफ 30 हाउ मच इट इज डिटेक्टिंग टेल मी. 30 के अंदर 20 को डिटेक्ट करेगा पॉजिटिव आउटकम ना. सो 20/30 that is sensitivity. Repeat again. I'm asking how many are having disease. Total 30. Yes. In that how many are detected as deceased? 20. 20/30 क्या हो जाता है? सेंसिटिविटी. व्हाट इज सेंसिटिविटी का डेफिनेशन? रिपीट. सेंसिटिविटी मीन्स, yes, very good, ability of a test. Yes, repeat. Ability of a test to detect how many are true positives. Ability of a test to detect how many are true positives. Means ability of a test to detect true positives. In the same way, tell me ability of a test to detect true negatives. क्या होता है? Specificity. Out of 2000, 1820 are true negatives. 1820 are true negatives. So what is this calculation? What you are doing? Sensitivity, specificity. Screening test का outcome है. How good is the screening test? उसका validity पता करने के लिए we are calculating what? Validity has two components. Yes, tell me. Sensitivity and specificity. Like this if you come. Sensitivity, like this if you come, it is specificity. So एक बार क्लास नोट्स को भी रिवाइज करना होगा. ये सब रैपिड रिवीजन सेशंस है ना. 1 आवर का एक प्रीवियस ईयर जितने भी है तो उसको एक साथ में रिकैप करवा लो. थोड़ा सा इजी हो जाता है बच्चों को जो मेन टॉपिक्स ना. अगर क्वेश्चन आ जाता है तो विल नॉट मेक मिस्टेक इन दैट क्वेश्चन. दैट इज द मेन पर्पस ऑफ दिस. नाउ टेल मी व्हाट इज मीन. ओके, टेल. वेरी गुड. मीन का मतलब एवरेज. वेरी गुड. व्हाट इज मीडियन? यस, मीडियन मीन्स सेंट्रल वैल्यू. अगर 1 2 3 4 5 है. यस, इजी क्वेश्चन आई एम आस्किंग. सेम बेसिक लेवल ही पूछेंगे आपको स्क्रीनिंग एग्जाम के अंदर. 1 2 3 4 5. व्हाट इज मीडियन? 3. 1 2 2 3 4. व्हाट इज मोड? 2. मोड का मतलब मोस्ट फ्रीक्वेंटली अकरिंग एंटिटी. जो नंबर ज़्यादा रिपीट होता है ना वो मोड है. मीन मीडियन मोड. यस, वेरी गुड. मीन मीडियन मोड इक्वल है. अगर मीन मीडियन मोड इक्वल है ना, डाटा इज सिमेट्रिकल, बेल शेप डाटा. मीन मीडियन मोड अलग है तो फिर स्क्यूनेस. अगर मीन सबसे ज़्यादा होगा, देखो मीन इज 20, मीडियन इज 10, मोड इज 5. अगर वैसे दिया आपको सीक्वेंस, देन द graph, the data is skewed towards right side. It's a revision session, so I'm giving it all in a rapid revision mode. सिर्फ रिविजन सेशन 1 घंटे का सेशन से पूरा पीएसएम पता चल, मतलब यू विल बी अंडरस्टैंडिंग एवरीथिंग. नो, यू हैव टू रिवाइज द नोट्स बेसिक. फिर ये सब रैपिड रिकैप विल बी इजियर फॉर यू टू रिकॉल ऑल द टॉपिक्स. यस, मीन सबसे ज़्यादा होगा राइट स्क्यूड डाटा. मीन सबसे नीचे है लेफ्ट स्क्यूड डाटा. इफ आई टेल लाइक दिस, मीन 1, यस, वेरी गुड, मीडियन 2, मोड 3. रिपीट. मीन 1, मीडियन 2, मोड 3. अगर वैसे देंगे आपको 1 2 3, मोड सबसे ज़्यादा होगा. इट इज लेफ्ट स्क्यूड डाटा. ऑलवेज रिमेंबर when you are having distribution like this, like 1 2 3 4 5 99, but school class exam scores है 1 2 3 4 99 99. एक स्टूडेंट है उसका स्कोर है, देखो. इट इज नॉट नॉर्मल, इट इज अबनॉर्मल. आउटलेयर बोलते हैं हम उसको स्टैट्स के अंदर. व्हाट वी कॉल इट एज? outlier. We call it as outlier in stats. Very good. Outlier present in the data, it is called as skewed data. Whenever the data is skewed, you should not use mean. एवरेज स्कोर नहीं निकालते हम उसको. क्या यूज करेंगे स्क्यूड डाटा के लिए? मीडियन. सेंट्रल वैल्यू शुड टेक मीडियन. फिर आपको सैम्पलिंग पूछेंगे. टाइप्स. सिंपल रैंडम सैम्पलिंग. 100 स्टूडेंट्स आर देयर. लिसन, I want 10 students. इतना ही चाहिए मुझे. 100 students में 10 students I want. Randomly you pick. Lottery method. You'll be selecting 100 में 10 students randomly. That is called as simple random sampling. Systematic random sampling calculation के हिसाब से होता है every third, every 10th and all we have. But for you screening exams it's rarely asked. स्क्रीनिंग एग्जाम्स के लिए वन मोर थिंग व्हाट वी आस्क इज स्ट्रैटिफाइड रैंडम सैम्पलिंग. ये काम करेंगे दो अलग अलग ग्रुप किया हमने. देखो यहाँ पर बॉयज़ को एक तरफ, गर्ल्स को एक तरफ. एग्जाम्पल आई एम टेलिंग. दो अलग अलग ग्रुप करोगे, मेल फीमेल. रिपीट, मेल फीमेल. दो दो ग्रुप्स हो गया. उसको क्या बोलते हैं? उसको स्ट्रैटिफिकेशन. ग्रुपिंग का मतलब स्ट्रैटिफिकेशन. ग्रुप का साइज है उसके हिसाब से पिक करेंगे हम लोग. यहाँ पे दो इंडिविजुअल्स को, यहाँ पे तीन, बिकॉज थोड़ा ज़्यादा है ना, तो प्रोपोर्शन वाइज मेंटेन करेंगे हम. वी मेंटेन द प्रोपोर्शन ऑल्सो. What is this called as? Proportion to its size sampling. अगर ये वर्ड आ गया आपको एग्जाम के अंदर, ग्रुप्स we do, randomly we pick according to their size. If these words come, stratified random sampling. क्या मार्क करोगे एग्जाम के अंदर? Stratified random sampling. Cluster random sampling means groups. वैसे तीन तीन लोगों का एक ग्रुप बन गया, फिर इस ग्रुप को उठाओगे, इस ग्रुप को उठाओगे. थ्री मेंबर्स आर देयर इन द ग्रुप, इट इज क्लस्टर. Then randomly select two clusters. How many clusters are there? 1, 2, 3, 4, 5. Two clusters are selected randomly. So what is the difference? Yes, बाकी सब में individuals को randomly उठाएंगे. Remaining all the other sampling individuals are randomly selected. But in cluster random sampling, very good. Clusters are randomly selected. Repeat my words. Clusters are randomly selected. Good. Next. टेस्ट ऑफ सिग्निफिकेंस. आपको स्टूडेंट टी टेस्ट, काई स्क्वायर टेस्ट, बार बार आएगा क्वेश्चन. स्टूडेंट टी टेस्ट, काई स्क्वायर टेस्ट. इफ आई वांट टू कंपेयर मीन वैल्यू बिटवीन टू ग्रुप्स, वी यूज स्टूडेंट टी टेस्ट, also called as unpaired t-test. Mean height between two groups, 10 centimeter, 20 centimeter. Example I'm telling. Mean height 50 inch, 60 inch. If I want to compare the difference, we use student t-test. अगर मीन वैल्यू है, मोर देन टू ग्रुप्स का कंपेयर करना होगा आपको. ग्रुप 1 मीन वेट इज 60 kg, ग्रुप 2 मीन वेट इज 40 kg, ग्रुप 3 मीन वेट इज 10 kg. आई वांट टू कंपेयर द डिफरेंस इन मीन वैल्यूज for more than two groups. What test is used? ANOVA test. Very good. Yes, correct. Repeat. ANOVA test. Yes, very good. Mean values one group before intervention, after intervention. एक ग्रुप को लिया आपने. For example, one group of diabetics now. Mean blood sugar 200. After intervention, mean blood sugar is 100. That intervention is working or not? To assess that, वो देखने के लिए mean one group before after we use paired t-test. Repeat my words. What we use? Paired t-test. Proportions. I want to compare between two or more than two groups. Like group 1 60%, group 2 20%. Group 1 का success rate is 60%, group 2 का success rate is just 20%. Group 1 was getting treatment, group 2 was getting placebo. Proportions I want to compare या तो दो ग्रुप्स के बीच में या more than two groups. 60%, 20%, 10% है. Three groups also. We use chi-square test. Then come to these words. Proportion, yes, very good. One group before intervention, after intervention. Like 20% hypertensives in a group now. Repeat my words. How many are hypertensives? 20%. After intervention, after lifestyle modification, 10% hypertensives are there. One group before, after intervention, we use McNamara test. McNamara test, yes. Association means smoking, yes, no. Lung cancer, yes, no. Two things are there. I want to associate. Like smoking is associated with lung cancer. Studies will be done like case control study. Yes, what you're telling is good. Cohort study, yes. But if they ask significance of association, if क्वेश्चन आपको 3-4 बार रिपीट हो चुका है. रिपीट सिग्निफिकेंस ऑफ एसोसिएशन. व्हाट इज योर आंसर? chi-square test of association. Repeat my words. Chi-square test of association. One more important thing what they might ask for you is what is correlation. Repeat the words. Correlation. Correlation मतलब क्या हो गया? Repeat. Relationship. Yes, relationship between two quantitative data. If you go to class now, study their height and weight. Height के साथ weight भी बढ़ेगा. तो फिर if I am putting height here, weight here, height is increasing, weight is also increasing. What type of correlation you can see? Positive correlation. Or if I check income of a country, if it is increasing, infant mortality rate is decreasing like this. Slowly it is landing down. Negative correlation. What are these diagrams used to represent correlation called as scatter diagram? Scatter diagram is used to represent correlation. दो वेरिएबल्स के बीच में रिलेशनशिप निकाल दो. अगर हाइट के साथ पल्स रेट चेक करो इंडिविजुअल्स का, हाइट एंड पल्स क्या रिलेशन है? हाइट पल्स में क्या रिलेशन होता है बेटा? रिपीट. वेरी गुड. नो कोरिलेशन सर. दैट इसका मतलब टेक ऑफ भी नहीं होगा, लैंडिंग भी नहीं है. टेक ऑफ है तो पॉजिटिविटी, लैंडिंग है तो नेगेटिविटी. क्लियर? वहीं पर है, फ्लाइट वहीं पे रुका होगा. दैट इज नो कोरिलेशन. यस. ट्यूबरक्लोसिस पता होना चाहिए. इंडिया में एनटीईपी बोलते हैं उसको. क्या प्रोग्राम है? रिपीट. यस, नेशनल टीबी एलिमिनेशन प्रोग्राम. डायग्नोसिस के लिए क्या यूज करेंगे? सीबी नेट. आजकल सब में सीबी नेट करते हैं हम. अगर ट्रीटमेंट चालू करना है, पॉजिटिव है टीबी, पॉजिटिव ड्रग सेंसिटिव टीबी, वी यूज 6 months of treatment. 2 months of intensive phase, yes. 4 months of continuation phase. Intensive phase, continuation phase. Isoniazid, rifampicin, pyrazinamide, ethambutol. Repeat with me. Very good. Yes. Isoniazid, sir. Yes, very good. Rifampicin, sir. Very good. Pyrazinamide, ethambutol. यहाँ पे आइसोनियाजिड, रिफैम्पिसिन, एथाम्ब्यूटॉल. HIV TB. यस. पेशेंट को अगर HIV है तो TB स्क्रीन करना पड़ेगा. रिपीट. वी हैव टू स्क्रीन फॉर ट्यूबरक्लोसिस. If the patient is having TB, you have to screen for HIV also. That is called as cross-referral mechanisms. Cross-referral mechanism. Most common opportunistic infection in HIV. Answer is tuberculosis. Tell me. The most common opportunistic infection in HIV is tuberculosis. Diagnosis of TB, we use CBNAT. Everyone, patient अगर HIV पॉजिटिव है तब भी we use CBNAT to rule out tuberculosis. TB HIV अगर साथ में डायग्नोस हो गया, HIV TB was diagnosed together. Listen to the words properly. HIV diagnosed together along with TB, HIV was diagnosed together. स्टार्ट टीबी ट्रीटमेंट फर्स्ट. ATT चालू करेंगे पहले, फिर बाद में ERT. रिपीट माई वर्ड्स. व्हाट वी स्टार्ट विथ? ATT, देन वी स्टार्ट विथ ERT. फर्स्ट स्टार्ट टीबी ट्रीटमेंट. 2 weeks का गैप होगा. हाउ मेनी वीक्स ऑफ गैप वी कीप? टाइप इट. 2 weeks. Then we add ERT. Then we are adding ERT. TB case, I want to notify. There is a website, online notification of TB के लिए website. क्या website है? What is the name? निक्षय, क्षय रोगा. टीबी का वेबसाइट है निक्षय. मंथली नोटिफिकेशन इज थ्रू निक्षय ओनली. निक्षय पोषण अभियान. पेशेंट को कितना मिलेगा पैसा? अब सुनो. पेशेंट न्यूट्रिशन इज वेरी इंपॉर्टेंट टीबी पेशेंट के लिए. सो एवरी मंथ, बिफोर इट वाज 500 rupees. नाउ हाउ मच यू आर गिविंग? 1000 per month for TB patient. What is this scheme called as? निक्षय पोषण अभियान. Repeat my words. NPY. निक्षय पोषण अभियान. What is 99 dots in TB? क्या होता है 99 dots? Can anyone tell? Yes. Very good. हाँ, TB ट्रीटमेंट पैक्स है ना, नीचे नंबर रखते हैं हम लोग. हिडन नंबर्स वी कीप. यस, हिडन नंबर्स. पेशेंट विल गिव, टाइप दैट नंबर एंड विल गिव मिस्ड कॉल. कोई फोन नहीं उठाएगा वहाँ पे. नोबडी विल रिसीव द फोन. हाँ जी ले लो, वैसे नहीं है. नोबडी विल रिसीव द फोन. इट इज मिस्ड कॉल इनिशिएटिव. मिस्ड कॉल आएगा, फिर डिटेक्ट हो गया. इट विल टेल वेदर द पेशेंट इज डिस्पेंसिंग टैबलेट्स और नॉट. टेल मी. वेरी गुड. Yes, 99 dots. Very good. Can indicate. Yes, monitoring adherence to treatment. True or false? 99 dots will help in monitoring adherence to treatment. Yes, sir. Correct, sir. Very good. Next. Janani Suraksha Yojana. Yes, Janani Suraksha Yojana. Mother is very important. We have to reduce maternal mortality. स्टेट्स को डिवाइड करेंगे हम लोग. LPS, HPS. क्या फुल फॉर्म है? लो परफॉर्मिंग स्टेट्स, हाई परफॉर्मिंग स्टेट्स. वेरी गुड सर. यस सर. वेरी गुड. लो परफॉर्मिंग स्टेट्स. यस, व्हाट यू आर टेलिंग इज गुड. हाई परफॉर्मिंग स्टेट. लो परफॉर्मिंग स्टेट यूपी उत्तराखंड, साथ में थे, अब डिवाइड हो गया. MP छत्तीसगढ़, नाउ इट इज 2. बिहार झारखंड, टोटल कितना हो गया? 6. राजस्थान, ओडिशा, जम्मू, असम. व्हाट इज द निमोनिक? रोजा. राजस्थान, Odisha, Jammu Kashmir, Assam. The mnemonic is Roja. Roja. Yes. High performing state. बाकी सब high performing है. Eligibility for cash. Low performing state. All the pregnants will get cash. No need to produce any other certificate. But high performing state, you have to show BPL certificate or ACST certificate. And this incentives what is given is irrespective of age and parity. Repeat my words, irrespective of age and parity. कितना मिलेगा कैश? लो परफॉर्मिंग स्टेट, हाई परफॉर्मिंग स्टेट, हॉस्पिटल डिलीवरी, रूरल एरिया मदर विल गेट 1400, high performing state 700, ASHA worker rural area 600 rupees. Yes, ASHA worker urban area 400 rupees. Yes, very good. For mother in urban area it is slightly less. So incentives are more in rural area. Remember this, incentives are more in rural area. Home delivery, how much a pregnant will get? Rupees 500 for below poverty line. This is one new initiative. Home delivery 500 for below poverty line. आशा को क्या मिलेगा? कुछ नहीं मिलेगा. होम डिलीवरी में कुछ नहीं. Don't ask doubt like what if Asha becomes pregnant? हाँ जी, यस. आशा अगर प्रेग्नेंट बन गई तो मदर हो गया ना, तो मदर का इंसेंटिव्स. क्लियर? वेरी गुड, इम्प्रेस्ड. जे, यस यस. के, जननी के साथ शिशु को भी कुछ मिलेगा आजकल. यस, देर इज नथिंग फॉर पितृ सुरक्षा, वैसे कुछ नहीं है. जननी शिशु क्या होता है? JSS के, यस, फुल फॉर्म जननी शिशु सुरक्षा कार्यक्रम. फ्री सर्विसेज विद यू, नो कैश. कैश तो JSO में मिल गया, यहाँ पे फ्री सर्विसेज है. टू whom? यस, प्रेग्नेंट सिक इन्फेंट. रिपीट विथ मी, यस, प्रेग्नेंट सिक इन्फेंट. क्या क्या सर्विस है? डाइट, ड्रग्स, डायग्नोस्टिक, transport, cesarean section, along with that free blood. We have this mnemonic DTC, Delhi Transport Corporation bus. Diet, drugs, diagnostic. T for transport, yes. C for cesarean section, B for blood. Pradhan Mantri Surakshit Matritva Abhiyan, what they do? Separate antenatal clinics will be there. Separate antenatal clinics, and 9th of every month, they'll be identifying the danger signs when they come to the clinic. अगर आपको कुछ लगा मतलब इनको है प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन, you have to paste blue sticker. That means they paste stickers. Yes sir, they paste sticker. Green, no risk factor. Red, high risk pregnancy. Blue, pregnancy induced hypertension. Yellow sticker for comorbid conditions. Give some example for comorbidities: diabetes, hypothyroidism, and pelvic inflammatory diseases. Diabetes means gestational diabetes. GD, gestational diabetes. What is this scheme? Stickers, tell me. Green, red, blue, yellow. क्या scheme है? प्रधानमंत्री सुरक्षित मातृत्व अभियान. What is लक्ष्य scheme? Yes, good. Labor room quality, to promote labor room quality. Very easy to remember. LL, labor room quality assessment and promotion, to upgrade labor room quality. All this will be under Lakshya scheme. चाइल्ड हेल्थ के लिए क्या क्या इनिशिएटिव्स है? अभी जो हमने मदर के लिए पढ़ा था ना, मैटरनल मोर्टालिटी. चाइल्ड हेल्थ के लिए रिमेंबर HBNC, होम विजिट्स बाय आशा वर्कर. She will go house to house. She will detect the danger signs. She will refer the child. Home visits, 7 visits for home delivery on these days. 6 visits for normal vaginal delivery. 5 visits for cesarean section. Discharge होने के बाद, after discharge, she will be giving all these visits. Tell me in descending order. 7, 6, 5. How much incentives for Asha? 250 per child. This is one more scheme. HBYC, फिर से पैसा आशा वर्कर को. होम विजिट्स बाय आशा वर्कर, 5 visits, 3, 6, 9, 12, 15th month. Every 3 months once. Total 5 visits. How much incentives? 250 per child. This is HBYC, home based care of young child. What is RBSK? Can anyone type it? Yes sir, very good sir. Yes, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम का मतलब क्या होता है बेटा? टेल मी. स्क्रीनिंग करते हैं हम लोग. क्या एज ग्रुप में? 0 to 18 ईयर्स. 0 to 18 ईयर्स. क्या क्या स्क्रीन होता है इसके अंदर? रिपीट. डिफेक्ट्स, डेफिशिएंसीज का मतलब क्या डेफिशिएंसीज है? यस, वेरी गुड. टेल मी. न्यूट्रिशन, वेरी गुड. न्यूट्रिशनल डेफिशिएंसीज, यस, वेरी गुड. Diseases, yes, and developmental delay along with disabilities we have to screen. How many Ds? 4 Ds. क्या स्कीम है? राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, वेरी गुड. मलेरिया ट्रीटमेंट तो पूछेंगे आपको, फार्मा क्वेश्चन है, PSM क्वेश्चन है, तो मेडिसिन रिलेटेड, यस वेरी गुड, मेडिसिन ऑल्सो. Treatment, falciparum, we use ACT, how many days? 3 days. Yes, type it, yes, ACT 3 days. Primaquine 1 dose. नॉर्थ ईस्ट स्टेट में क्या यूज होता है? ACT, आर्टीमीटर, लोमिफेंट्रिन. अदर स्टेट्स आर्टिसुनेट, SP. यस, बाकी जितने भी स्टेट्स हैं वहाँ पे ACT क्या यूज होता है? रिपीट, आर्टिसुनेट, SP. Vivax malaria, we use chloroquine for 3 days. Primaquine for 14 days. Liver, yes, hypnozoids will be there, that is responsible for relapse. Primaquine 14 days will reduce the incidence of relapse, yes. Mixed infection, ACT for 3 days, very good. Primaquine for 14 days. अगर दोनों है, falciparum plus Vivax, we mix it. Mocktail, yes. Cocktail, your favorite, yes, fine, okay, cocktail. I don't drink, so for me it's mocktail. ACT for 3 days, Primaquine for 14 days. Oval, same as Vivax. Malaria same as falciparum. Oval का treatment same as Vivax. Malaria का treatment same as falciparum. Yes, 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 correct, good. Pregnancy, Primaquine नहीं देंगे हम because it is contraindicated. Falciparum, first trimester, highlight करो उसको. Yes, first trimester quinine, other trimesters ACT, because ACT is contraindicated in first trimester. Vivax we use chloroquine, but what is that drug which is contraindicated? Type it. Yes, Primaquine is contraindicated, very good. Chemoprophylaxis, if I want to go into an endemic area, malaria endemic area, I have to take chemoprophylaxis. Up to 6 weeks stay we use doxycycline. After 6 weeks, if I am staying there for long term, before only I should decide what is the duration of my stay. अगर आपका stay planned है, 2 months of stay, so we cannot use doxycycline, we have to use mefloquine. So what is DM? District magistrate. Repeat my words. What is DM? District magistrate. अगर contraindicated है, सुनो, doxycycline or mefloquine you cannot give if there is any contraindication. For example, convulsion. Convulsion, mefloquine is not advised. In such situation, we have to use chloroquine. If there is any contraindication, we have to use chloroquine. So tell me the mnemonic. DMC, Delhi Medical Council. Delhi Medical Council. Doxycycline, mefloquine, chloroquine. Yes, next. Kala-azar. Patient कैसे आएगा? How the Kala-azar will present? How the patient will come? Tell me. Very good. Yes. Fever. Very good. Anemia. Hepatosplenomegaly. 3 words I want. Fever, anemia, hepatosplenomegaly. Patient is not responding to any other drugs. Rule out Kala-azar. RK39 test करो. Do RK39. Small drop of blood. Positive report. Start treatment. RK39 positive, we have to start treatment. Drug of choice, now we are using liposomal amphotericin B. Not, yes, no, not sodium stibogluconates. What we are using? Liposomal amphotericin B, single dose infusion. Single dose infusion. Oral treatment. Patient is telling, sir, I don't want IV drugs. Give me oral. I will come in front of you. आऊंगा sir, सामने. Yes, सामने सामने, face to face. That is called as directly observed treatment. Repeat my words. Directly observed treatment. Miltefosine. Now tell what is the drug of choice. Type it in the chat box. Type it in the comment box. Yes, liposomal amphotericin B, LAM. What is the oral treatment? Miltefosine. Very good. Directly observed treatment. Indoor residual spray. Sand fly is the vector. Cattle sheds है, जो गाय वगैरह रखते हैं ना वहाँ पे cattle sheds है. Sand fly is jumping like this. Yes, 6 feet तक it can jump. How much? 6 feet it can jump. You are doing indoor residual spray using synthetic pyrethroids. S for sand fly, Yes, for synthetic pyrethroids, that is for vector control. क्या vector control करोगे? Phlebotomous argentipase. Yes, Phlebotomous argentipase for sand fly. Very, very good. Yes. HIV treatment. Tell me. Very good. Open the notes. Yes. जो भी नोट्स होगा आपके पास, मेन नोट्स रहेगा ना तो क्लास का. ERT, एंटी रिट्रोवायरल थेरेपी. पेशेंट को क्या देते हैं हम आजकल? HIV पेशेंट है. CD4 count, yes, we don't consider for starting treatment irrespective of CD4 count. Very good. क्या बोलते हैं हम उसको? Test and treat policy. Yes, HIV patient में we follow test and treat policy. Tenofovir, lamivudine, dolutegravir. Repeat, TLD. Tenofovir, lamivudine, dolutegravir. Pregnant है तो फिर we give TLD only. Same. Tenofovir, lamivudine, dolutegravir. For pregnant also we use TLD. Tenofovir, lamivudine, dolutegravir. Newborn, if the mother was taking treatment, use nevirapine. Minimum duration 6 weeks, maximum duration 18th month. Repeat my words. Minimum duration 6 weeks, yes, maximum duration 18th month. Not on ERT. If the pregnant is not on ERT, infant is high risk. दो ड्रग्स यूज करेंगे नेविरपिन के साथ जिडोविटिन. याद रखना इजी है. यस, याद रखने के लिए भी इजी होगा. सुनो, नेविरपिन न्यूबॉर्न. Mother is not on ERT, we have to use nevirapine plus zidovudin. Cotrimoxazole prophylaxis from 6 weeks we start to prevent pneumonia. Early infant diagnosis is done at 6 weeks now. HIV है कि नहीं देखने के लिए न्यूबॉर्न में ना, न्यूबॉर्न अर्ली इन्फेंट डायग्नोसिस ऑफ HIV is done at 6 weeks using total nucleic acid PCR. Type it. Yes, total nucleic acid PCR is done at 6 weeks to rule out HIV in newborn. क्या बोलते हैं उसको? Early infant diagnosis. Yes. What is this? TLD is the treatment. Pregnant CS TLD. Any adult HIV positive we are using TLD. Now come to polio. How polio will present? Acute flaccid paralysis. Very good. AFP. 2 सैंपल्स लेना होगा पोलियो रूल आउट करने के लिए. 2 stool samples we check 24 hours apart. Ideally within 2 weeks. Maximum duration within 2 months. After that, no use of sample collection. Transport it to lab using 2 to 8 degree temperature. That is same vaccine carrier will be using like this with 4 ice packs. The stool samples is reaching lab. That is called as reverse cold chain. Repeat my words. Reverse cold chain. Then the sample should reach lab within 3 days. Repeat, how many hours? 72 hours. Within 3 days. 60-day follow-up, we check whether muscle weakness, wasting is there or not. That is called as residual follow-up at 60th day. Then the report has to come whether it is polio or not. Maximum days within 90 days आपको report देना होगा. मतलब higher authorities को ना. Polio has been eliminated. Yes, very good, but not eradicated. So any case of AFP, we have to rule out polio. क्या disease rule out करना होगा? Repeat. We have to rule out polio. Yes. Leprosy का treatment is same. Nowadays we use this regimen. Rifampicin 600 mg, clofazimine 300, dapsone 100 mg. This is day 1 treatment. बाकी days के लिए we use clofazimine 50 mg, dapsone 100 mg. Clofazimine 50, dapsone 100. Paucibacillary treatment is for 6 months. Multibacillary treatment is for 12 months. Repeat. Paucibacillary is 6 months. Multibacillary 12 months. Chemoprophylaxis within the family we use single dose rifampicin. To create awareness in the leprosy we use Sparsh campaign. See the mascot used in the Sparsh campaign? School girl Sapna. The mascot used under Sparsh campaign to create awareness. Answer is Sapna. Yes. Now tell what is the duration of paucibacillary treatment? 6 months. Yes, type it. What is the duration of multibacillary treatment? 12 months. Very good. Syndromic management. How many kits are there? 7. Just recently we had one more kit also. Kit 8 also. Kit 1 is used for urethral discharge, cervical discharge. Kit 1 anorectal discharge, it has been changed to kit 8 now. अगर एनोरेक्टल डिस्चार्ज है तो वी यूज किट 8 ब्राउन कलर किट. Kit 2 green vaginal discharge, kit 3 white and kit 4 blue. Kit 3 and 4 is used for non-herpetic ulcer. If the patient is allergic to penicillin, repeat the words. The patient is allergic to penicillin. What kit is used? Kit 4 blue color kit. Kit 5 red color, that is for herpetic ulcer. Kit 5 red color, it is for herpetic ulcer. Kit 6 yellow color, it is for lower abdominal pain. Kit 6, it is for lower abdominal pain. Kit 7 black color, it's for inguinal buboes. Tell me the colors. Gray, green, GG, white, blue, red, yellow and black. What is new kit introduced? Tell me the answer. Yes, brown kit. Anorectal discharge, we use cefixime plus doxycycline. Correct the spelling. We use cefixime plus doxycycline. Anorectal discharge. Post exposure prophylaxis, rabies के अंदर. The patient after a dog bite, we use thigh red cross schedule. Intradermal schedule है. दोनों pricks, दो तरफ, मतलब two pricks are there, two side. यहाँ पे एक prick होगा, यहाँ पे one prick. Injection. One injection intradermal. 4 visits for the patient. कब कब देते हैं? 0, 3, 7, 28. Patient in front of you, that is taken as 0. From that you tell him come after 3 days, 7th day and 28th day. Patient is asking for intramuscular thing, like I want IM sir. Okay, फिर आपको एक दिन ज़्यादा आना पड़ेगा, मतलब 1 visit more for the patient. 14th day. What is this? Intramuscular schedule. Thigh में कितना letters है? Tell me. Thigh 4 letters. How many visits? 4. SN how many letters? 5. How many visits? 5. We use deltoid now. यहाँ पे gluteal दिया होगा ना, उसको हटा के deltoid करो. We are using deltoid now, not gluteal areas. Good. Pre-exposure prophylaxis. Those who are at risk of dog bite or risk of animal bites, like veterinary doctors हो गया. Yes, forest zoo handlers, like all the animal handlers, what they use to catch the animals and all, they'll be taking 3 visits. 0, 7, 21 or 28. Either they'll come on 21st day or 28th day. Re-exposure, again and again the dog is biting. आपको पता होना चाहिए, तो दिक्कत आप में होगा नहीं तो डॉग में, फिर समझौता होना चाहिए. Dealing should be done. Re-exposure means dog is biting again and again. Within 3 months, you have completed the vaccine. Today, yes, tomorrow there is dog bite. Nothing to worry. Within 3 months, nothing to be done. After 3 months, 0,3, 2 visits. After 3 months, if the bite is there, 2 visits, 0,3. Don't give immunoglobulins. Second time exposure, no need of immunoglobulins. Now tell thigh 4 visits, SN how many visits? 5 visits. Crimean Congo hemorrhagic fever. Cattle, camel is the reservoir. Vector is heart tick. Remember CCH. Cattle, camel, heart tick. याद रखने के लिए. If you are exposed to cattle and camel, if your work is like that, then if there is bite by heart tick, you'll suffer with fever rash. That is called as Crimean Congo hemorrhagic fever. They'll ask. Nipah. Fruit bats. First bat, pig, man. That is one route which happened in Malaysia. Then bat was dropping the urine in date palm sap. Then you are affected. That was happening in Bangladesh. Yes. Then man to man will go. In the family it will go. Highly fatal. It will present as encephalitis. How Nipah will present? Brain encephalitis. That is why the differential diagnosis is Japanese encephalitis. Yes, good. After exposure to bats, you will suffer with internal bleeding and death. Body में bleeding है, shock है, hemorrhagic shock है. It is Ebola hemorrhagic fever. Don't confuse. Tell me the answer. Very good. Bat encephalitis. Nipah, bat bleeding death. Repeat my words. Bat bleeding death. Your answer should be Ebola hemorrhagic fever. Zika after exposure to Aedes mosquito. There is chances of fever rash in the body. Almost similar to dengue only. Not that fatal. It's not that fatal. But if pregnants are infected, ये word important है. Pregnants are infected with Zika, that will lead to microcephaly. So Zika can lead to congenital malformation. True or false? True. Zika can lead to congenital malformation. ट्रू स्टेटमेंट. नेक्स्ट, जो मेन स्कीम्स है ना, सुनो. अभियान इंद्रधनुष मतलब क्या होता है? ये हॉस्पिटल्स के अंदर every day they'll change the color of the bed sheets with care pattern. We violet on Sunday, so it will promote sanitation. Antara is injection. Don't make mistake. It is injectable contraceptive, DMPA, progesterone injection given once in 3 months. Chaya pills is centroman tablets. Non-steroidal OCP. Non-steroidal OCP. Yes. ESI benefits. जो वर्कर्स है ना, ESI इंश्योरेंस भरते हैं ना, they'll pay premium to the ESI company. They'll pay premium to the ESI company. So sickness benefit is for how many days? 91 days. Yes. Extended sickness is for how many days? 2 years. Maternity benefit 26 weeks. Yes. Pregnancy. Kayakalp is what? To promote sanitation in government hospitals. They'll be giving quality guidelines. You have to fulfill all those quality guidelines. Abhiyan Indradhanush is only bedsheet, but Kayakalp is for promoting everything. Overall assessment is done. They'll give cash awards for achieving that quality also. It is in government hospitals to improve the quality of sanitation in public health facilities. Fertility indicators, very important. So now listen. Number of live births per 1,000 mid-year population, it is crude birth rate. Number of live births per 1,000 women in the reproductive age. Only women in the reproductive age, reproductive women may take in the denominator, that is general fertility rate. Average number of children per woman means one woman will have how many children on an average, that will indicate family size, that is total fertility rate. Total fertility rate. There is a formula to calculate crude birth rate using total fertility rate. They might ask this question also. Only girls we count. Average number of girls per woman, it is gross reproductive rate. What is total number of children? Total fertility rate. Only girls we count, it is gross reproductive rate. It is half of total fertility rate. Repeat my words, it is half of total fertility rate. Net reproductive rate is average number of daughters a newborn girl will have in the future. छोटी सी newborn है, she will become a reproductive woman in the future. How many girls she will produce? That is calculated, and that is called as net reproductive rate. Means we have to consider both fertility and mortality pattern. How many years she will live? After that, how much she will consume? This means mortality is also considered. Very good, correct. Mortality pattern is also considered in what indicator? Net reproductive rate. बाकी सब में नहीं होता है. बाकी remaining all the things we consider only fertility, but NRR we consider both fertility and mortality together. How many are using contraceptives? Like that is called as couple protection rate in the community. Out of 100 couples, 50 are using contraceptives. Out of 100 couples, 50 are using contraceptives. That is called as contraceptive prevalence rate or couple protection rate. Will indicate the percentage of couples using contraceptives. MCH indicators आपको कैलकुलेशन देंगे एग्जाम के अंदर. Neonatal mortality rate, infant mortality rate, maternal mortality ratio. These three things are important. Neonatal mortality rate, infant mortality rate, and maternal mortality ratio. Listen. Perinatal mortality means stillbirth and early neonate we count. Stillbirth means any death which happens after 28 weeks of gestation. 28 weeks of gestation for India. Neonate within 28 days. Post neonate is 28 plus till 1 year. So anything within 1 year, it is called as infant mortality rate. Repeat, neonate is within 1 month, infant is within 1 year, under 5 is within 5 years. When I want to calculate all the indicators, denominator is live birth. Repeat, denominator is live birth. What is the multiplier? 1000. Maternal mortality ratio, listen. How many deaths which happen within 42 days during pregnancy, delivery, and within 42 days? Yes, 42 days, irrespective of the duration and site of pregnancy. Ectopic also we count any death which happens. Anything during management like cesarean section complication we count. Not from accidental causes. अगर किसी को डेथ सुसाइड की वजह से हो गया, होमिसाइड, or shocks, all those things we not count. Mean, what is that? Electrocution means electric shocks and all those things which happen. So we don't count. We don't count. Very good. What is the denominator? Live birth. What is the multiplier? 1 lakh. What is this we calculate? Maternal mortality ratio. Repeat my words. MMR, maternal mortality ratio. B1 deficiency. Tell me. Thiamine deficiency can cause very dry, wet. Dry, very peripheral neuropathy. Wet, very congestive cardiac failure. Yes, good. Wernicke's encephalopathy seen in chronic alcoholics. Very good. Riboflavin deficiency. Angular stomatitis. Niacin deficiency. Pellagra. What necklace we see? Castle's necklace. Diarrhea. Dermatitis. Dementia. We see in maize and jowar consumption. Pantothenic acid B5, pyridoxine B6. Pantothenic acid deficiency, burning feet syndrome B6, pyridoxine, peripheral neuropathy. Like isoniazid if I am using for TB management. Repeat, INH, isoniazid. Pyridoxine can cause peripheral neuropathy. B9, megaloblastic anemia. B9 is folic acid deficiency, megaloblastic anemia. If your diet is only vegetarian based diet, B12 deficiency can happen. E and K. Don't confuse. Vitamin E is antioxidant. Listen. If there is no antioxidant, oxidation can release free radicals and that can cause hemolysis. Vitamin K is for clotting factors. If there is no clotting factor, there will be bleeding manifestation, hemorrhagic disease of newborn. So how to prevent HDN? At birth, we are giving vitamin K1 injection to prevent hemorrhagic disease of newborn. Yes, good. What is this? Iron folic acid tablet. Anemia Mukt Bharat. Very good. 6 months to 5 years. Bi-weekly dete 1 ml syrup. Within a week 2 times. Bi-weekly 1 ml syrup. 1 ml has 20 mg elemental iron. 100 microgram folic acid. Children 5 to 10 years. You can write it as 5 to 10. Weekly 1 spink tablet. Weekly 1 spink tablet. What is the composition? 45-400. Repeat the words. What is the composition? 45-400. Adolescent 10 to 19, we give weekly once blue tablet. The dose 60-500. Don't make mistakes. WIFS means weekly iron folic acid supplementation. We use blue tablet, not red tablet. 60-500. Pregnant, lactating. So starting from second trimester, we use red color tablet. The dose is 60-500. Repeat. Very good. Yes, correct. 60-500. During pregnancy, we give for 6 months. After that, we give for 6 months. During lactation, we give for 6 months. Total 1 year of supplementation. Reproductive women in this age 20 to 49 will get weekly once red color tablet. So it is red color tablet in reproductive women, red color tablet in pregnancy. Next, food adulteration and toxins. This question can come, listen. Laterism is due to consumption of yes, very good. Laterism is due to consumption of kesar dal, Lathyrus sativus. Toxin is beta oxalyl aminoalanine. If you are consuming kesar dal, toxin is there. Beta oxalyl aminoalanine. That will lead to spasticity, spastic paralysis. They will be walking with sticks. 1 stick, 2 stick. Then they need crawlers to walk. Spasticity. Vitamin C will help in prevention. Then epidemic dropsy. Argemone is added to mustard. It is adulteration. They are mixing argemone with mustard. Sanguinarine is the toxin. What is happening here? Pedal edema, cardiac failure, glaucomas. Repeat my words. Pedal edema, cardiac failure and glaucomas. Ask the food inspectors to go and take the samples of argemone. What is that? Mustard samples. They will collect mustard oil from the shops. If they get argemone, they'll use nitric acid test, most commonly done. Paper chromatography test is most sensitive test. Repeat my words. What is most commonly done? Nitric acid test. What is most sensitive test? Paper chromatography test, PCT. Endemic ascites is using crotoluria seeds. They are having hepatotoxic alkaloids. If you consume these seeds, there is jaundice ascites. Yes, repeat. Jaundice ascites. Ask them to separate them. Don't consume it. Aspergillus is storage fungus. When you keep these small food grains in the moisture, there is one black color fungus which accumulate on that. That is Aspergillus releasing aflatoxin, which is hepatotoxic. It will affect liver. So avoid moisture. Proper storage condition should be there to prevent aflatoxicosis. On bajra, there is one fungus which can grow in the field. That is field fungus. Claviceps purpura, C for claviceps, C for chronic consumption, C for constriction. There is vasoconstriction, pain, tingling, numbness in the feet. Float in salt water, salt flotation technique. How much percent salt water you are using? 20%. Salt flotation technique is used to prevent what? Ergotism. How ergotism will present? Sir, severe burning sensation in the feet. Saint Anthony's fire. That is how ergotism will present. Good. Entomology, important. Culex, Japanese encephalitis, Bancroftian filariasis, Aedes, yellow fever, dengue, Mansonia, Brugian filariasis. Anopheles, yes, malaria, easier. Sandfly, Kala-azar, Sassafly, sleeping sickness, louse, epidemic typhus, rat flea, plague. Flea, plague. Heart-tech, KFD. What is KFD? Casanur forest disease within India. Soft-tick, relapsing fever. These are all the important things what they are asking for you. I'm focusing only on most important things. 1 hour का session है तो फिर most important things have to focus. Trombiculid mite, scrub typhus, cyclops is the vector for guinea worm. Management techniques. So listen to the words properly. Management के अंदर cost benefit cost effectiveness पूछेंगे आपको. Input is cost, output is money. 10 rupees you are putting, 20 rupees you are getting. That is cost benefit analysis. Yes. 10 rupees you are putting, how many deaths you can prevent? That is cost effectiveness analysis. Output is results. Network analysis will show how you plan an activity. जो arrow diagram देते हैं ना, after starting from point A to point B, it will take 3 months. A to B 3 months, B to C it will take 6 months. Like if I start reading now, first reading 3 months, after that first revision 1 month, like that you plan arrow diagram. That is PERT. It's a type of network analysis. Work sampling is going every 5 minutes once or 10 minutes once and observing how they are working randomly to improve the efficiency of workers. That is called as work sampling. I've given the table for you. Sub-centers we have health workers, primary health centers we have doctors, community health center we have specialists. Plains sub-center 5,000 population, elite tribal areas 3,000 population. That is important. Health workers we have in sub-center. Health worker female is ANM. सब सेंटर ए एंड बी करके होता है. सब सेंटर बी में डिलीवरीज होता है. रिपीट, सब सेंटर बी दे कंडक्ट डिलीवरीज, सब सेंटर ए नो डिलीवरीज. Primary health center A and B, primary health center A will conduct less than 20 deliveries per month. Primary health center B will conduct more than 20 deliveries per month. Classification they will ask. Where you conduct cesarean section? Repeat. अगर cesarean section करना होगा तो where you conduct? Yes. Specialist, very good. Where? CHC, MDMS will be available from CHC level, community health center. That is what is called as first referral unit, because it is the first place to conduct emergency cesarean section. So these are the main things for screening exams. And one more thing what they will ask is the last thing, that is biomedical waste. Yellow bag. Anything which is contaminated with blood and body fluids. If I'm telling like this, swabs, linens, throat swabs, or cytotoxic thing, they'll ask this. Cytotoxic. Chemical liquids, blood bag, blood is red in color, it will go in yellow. Urine is yellow in color, it will go in red. Opposite time. Good. Used mask, yellow bag, it will go for burning, incineration. Red bag, we use the word TRP. Repeat, what is TRP? Tube, rubber, plastic. Yes, IV tubes, catheters, urine bags, syringes, goggles, nitrile gloves. All this will go in nitrile gloves. All this will go in red color bag. White. Anything which is sharp, like it will prick you, it will cut you. Scalpel needle, white, white. Scalpel needle, white. Blue, very important. Glass, broken or unbroken, it will go in blue only. If the glass is contaminated with cytotoxic waste, repeat my words, glass is contaminated with cytotoxic waste. cytotoxic word आ गया तो फिर yellow में जाएगा. Metals, nails, in orthopedics I'm telling, metallic implants, all this will go in blue bag. So usually we ask question for yellow bag only. For even the exams, most of the times we ask question for yellow bag. So this session, yes, we have finished. We have covered all the important topics superficially because it was 1 hour session, rapid revision session. Exam में ये सब आएगा, I'm telling again and again. You have to recall it in the exam. Any doubt you have in this, you can text me in my Instagram handle, Rajeev Sheety. Rajeev Sheety, you can go to Instagram handle and you can see my Instagram page there, Rajeev Sheety. And you can text me any doubt related to preparation or anything related to the subject or to the life, whatever we have learned from our life lessons also. If possible, yes, we can guide you through anything. I mean to tell normal, basic, superficial things. Yes, good. So any doubt or anything, if you want to text, you can use my Instagram handle, right? Rajeev Sheety. All the best for your FMG exams. I think I am waiting for you all to come to the other side so that we can go to the next level of preparation, that is NEET and INSCT preparation. Yes, possible to clear this. We can clear this exam. We will go to the next phase. One phase. It's possible. We are with you. Again, I mean to tell this. Any doubt, you can text me. All the best. Thank you so much.